Absolutely. I mean, we meet people on their own terms and respect people and their advanced directives and who they want to make decisions and provide support and unconditional love. I think the last thing that people need during a crisis is anyone judging them. We may all have our own sense of ultimate truth, and we could argue until, forgive me for saying doomsday, about what our perspectives of those ultimate truths are. But that is not our concern in chaplaincy, in healthcare chaplaincy. Our concern is healing and health for all individuals. Then we all go to our own congregations or wherever we meet our spiritual needs that may or may not be connected to very specific belief systems. But in the healthcare environment, we definitely meet the needs of the LGBT community as much as we can, and as much as people will tell us what their needs are.
As we speak, I will be under the knife at Sharps Hospital next Wednesday. And they call it outpatient, but I'm still going to have to be there 2 days. Maybe you can come visit me.
Give us your room number.
Yeah. If you could definitely have one of the staff people call the spiritual care office and ask for me, I will do my best to show or send one of our chaplain residents. It would be an honor.
That's fine. I'm going to need all the help I can get.
That sounds good. So will you have somebody make that referral when you come in? Will you tell one of the team members? Because there are all of these privacy regulations, and we have to be really aware of those. It's interesting.
I'll probably have to sign a sheet with papers like this.
No, I think you could just make the request in this particular case.
No, I mean for the doctor.
Oh, for the doctor?
For the doctor.
Oh, for the consent.
So he won't take any blame in case something goes wrong.
Right. Well, God willing, everything will go smoothly. I will keep you in my thoughts, heart, and prayers. Yeah.
So they monitor people that come into the hospital, like when my first wife was dying, people would come in and try to convert her, and
Yeah.
her mind was going, and it was really a bad scene.
If that ever happened internally, those individuals would not last another day at Sharp Healthcare. People, however, are opportunists, and they come in from the outside. And once we find that anything like that is going on, all precautions are taken. But in most healthcare environments now, and I would even say sectarian healthcare environments, nobody wants people to be violated. So, there are a variety of reasons why that might happen, and most likely today, at least I hope, it's not internal.
Is the Sharp approach unique, or is it becoming widespread across the medical community?
I would say both, that Sharp Healthcare is unique in its focus on serving all members of the greater San Diego area community. But I would also say that this is a trend in healthcare for clergy and lay leaders with theological degrees to receive training in the clinical field of chaplaincy.
Sharp has a number of hospitals around the county. Do you go to all of them, or are you stationed at one place?
I am based at Sharp Memorial Hospital, which is the Sharp Metropolitan Medical Campus, where you have Memorial and Sharp Mary Birch and the outpatient pavilion and Sharp Mesa Vista. And there's wonderful rehab there. We have chaplains throughout our system. However, the majority of the chaplain residents that I train, their students in chaplaincy, are at Memorial, and we have one at Grossmont, where our friend Chuck spends his time and gives so much to that community as well.
For Catholic